And so right now, the fines are the issue. EPA has a fine of $37,500 per day, a maximum. In Ohio, it's $5,000 per day. And so this has got to be worked out between ODH and EPA. And ODH is very much in the compliance assistant. They do not believe in issuing fines willy-nilly. They work very much with the owner or the contractor and try to work out an agreement. These are considered settlements. So if I actually asked for the data on their fines. They're very few, but they have a lot of settlements. And it usually involves a behavioral change, not just a monetary penalty. Okay, so I'm going to go real quick through these. We have a board member. She's our vice president, Laurie Sutherland. She's with the Community Housing Network. She developed a lead protocol for their properties. And basically, all of their contractors and maintenance crews are RRP trained and certified. They do not use licensed lead contractors right now in their current jobs, where they are working underneath the cap that triggers the lead abatement contractors with HUD money. She's shared the system at the Ohio Housing Conference a couple of years in a row. They use the same protocol for asbestos, and I'm using the slides with her permission. Okay, so they are an organization that rents affordable apartments to people disabled by mental illness, substance abuse, and who have histories of homelessness. They're a pretty large provider. They have mostly small properties scattered throughout Franklin County. They primarily house adults, not children, but they may have pregnant women in their units, and children visit the units. So for that reason, she developed a pretty interesting protocol. So, okay, we'll take this. Okay, so the first thing is they obtain lead-based paint inspections on every pre-78 property, and not just properties that they're renovating. So this is the beginning of their protocol. Okay, and they do an Excel chart for every unit in the building. Go to the next one. What are they going to be doing during renovation? They do drawings with highlights. And then the next one. Before rehab, this is an example, it'll be on the website, but what you can't read on here is that they're saying that in the interior and the exterior, they're saying exactly what room the lead has been found in, what's the component, and what's the treatment to be conducted. Okay. Then they have floor plan, and they have notes showing exactly where the lead is. And go ahead. And then after rehab, another Excel chart. Where is the remaining lead? Because obviously it's not feasible to totally remove lead from a property all the time. And so this is one chart they keep for their records. What did they do and where? And also because they give notices to the tenants of what's been done in the property. RRP requires that, by the way. If you're doing any kind of renovation, they come in there to make a repair and they're going to disturb the lead paint, they have to give the tenants a notice. Okay, and then after rehab, for maintenance purposes, what you can't see on this form is that they said there's lead remaining in the fascia, and the fascia was wrapped in metal. So they keep notes on everything that they did. So if they have to go back and redo something, they're going to know that they're going to be fooling with lead. Okay, and then after rehab, they have a diagram, and then next. Who needs to know? All maintenance technicians, staff who award subcontracts, and residents with the disclosure notice. And how do they know? So every maintenance tech has a binder in his truck with the charts and drawings. She says someday they'll be attached to a work order on Yardi. The drawings are laminated and hung up in the larger buildings, and I saw this when I went on a tour at the Ohio Housing Conference. Procurement has a binder. They can find it on the company's server, and there are recurring work orders in Yardi to inspect every unit with lead-based paint. So that's the end of my presentation, and I'll take questions after this.
Yeah. So next is, well, Steve is trying to ask you a question. Let's let him ask.
Are city lead orders now displayed on the same, on Easy Track, the same system that shows city building orders? Yep. Or are they still separate?
It's on the same.
It's on the same. So you can look at one and see all of them?
Yes.
Okay.
You can see, yeah, if you search by address, you'll be able to find all building orders, also anything actually on our property.
Okay.
I believe.
Great. Good.
So I'm with the department with the Childhood Lead Poisoning Prevention Program. If I'm not speaking loud enough, just kind of wave at me. I work mainly in our closed lead hazard control program at the time, but I'm also a licensed lead risk assessor for the health department, so I can do risk assessments and other stuff like that. So I kind of help out where needed. I am also the coordinator for the Hamilton County Healthy Homes and Lead Collaborative that works with lead and healthy homes issues within Hamilton County. So anyone who would love to attend those meetings, those are held on the third Wednesday every other month, and I believe our next one will be next month. So anyone interested, I have my card. I can get you set up on an email list as well. So why are we here? We haven't really touched base on why lead poisoning is important and how it affects kids. I'm not going to go into great detail about it, but lead poisoning is the #1 environmental disease for children. And the effects of lead poisoning are permanent. So we're talking about lower IQ, loss of education, behavioral issues. In addition, there's several costs to society and increased costs in education and other things. So that's why we are very focused on lead and why we are here to promote what we are doing. As well as lead poisoning is entirely preventable. There are things we are trying to do to prevent lead poisoning in future children, not just the children that are already lead poisoned. So I'm going to talk about what we do within our program. We kind of have it divided up into 2 different programs within the health department. One is our public health lead investigation program, which is what's mandated by Ohio Department of Health. And then the other is our closed lead hazard control program. We actually have our own grant within the health department to provide money for property owners to remediate lead hazards in their home. So we'll talk about those. So our public health lead investigation program, or I might just call it PHLI. It's fun to use a bunch of acronyms. So Ohio Department of Health delegates authority to perform public health lead investigations for residential homes, child care centers, and schools to us at the Cincinnati Health Department. We actually have risk assessors who are sanitarians as well that go out and perform these public health lead investigations. We actually receive referrals in 2 different blood level ranges, and that is greater than equal to 5, but less than 10, and then over 10. In the referrals we get for elevated blood levels between 5 and 10, the Ohio Department of Health actually mandates that we perform a comprehensive questionnaire to every referral that we get. Ones that we can contact, we do try to contact them. There are some that unfortunately we just can't find. And we provide lead education to them. Additionally, that education is cleaning. We provide cleaning supplies. We talk about why lead poisoning is important and what they need to do, what they can do for their child to reduce their lead level. Additionally, we provide a home visit by a dedicated nurse case manager in our office. This is not required by the state. We were actually the first program in the nation to do an intervention at 5 to 9, or for blood levels between 5 to 10. So we started that in 2007, and we originally did that program. Our nurse case manager took it from a nursing perspective. So she did developmental, nutritional, and growth assessments for the child, and made referrals to different agencies as needed, as well as they do a healthy homes assessment, which is actually something that was developed by ODH for their greater than 10 cases. She also does that assessment as well, and then she does the cleaning supplies and education. So we kind of go above and beyond in Cincinnati. We kind of take it from a nursing perspective for the child. Our main focus is the child. We want to make sure that we lower their blood level and make it safe for them. So the main difference between 5 and 10 and greater than 10 is the 5 to 10 levels, we will not do a risk assessment at the property. At this time, we are not mandated by the Ohio Department of Health to do that risk assessment. But levels above 10 and above, we will be. So we also have a nurse case manager, Angela, who's actually here with us, who is the case manager for those levels. We do an on-site investigation, and typically it's the case manager and the risk assessor, sanitarian, that goes out at the same time. They try to work together to find the children and also provide that education. We do the comprehensive questionnaire as well. In addition, we do a risk assessment. With that risk assessment, we look at a visual assessment of the property to look for bare areas of soil, look at different deteriorated paint and other instances. And then we do lead-based paint testing with the XRF gun. And we do dust sampling and soil sampling. We do not do water testing through the health department. We actually refer them to Cincinnati Water Works for all water testing. And then we also provide lead education. So the lead risk assessment, the purpose is to identify lead-based paint hazards in the home. As Patricia mentioned earlier, there are other sources for lead poisoning. There could be ceramics, toys, it could be cosmetics, food, and other stuff. But mainly we see that poisoning is coming from lead-based paint hazards. The dust that children get into their system, either inhaled or ingested. So that's where we typically focus. We will look at what is suspected to be the source of the child's lead poisoning. That's where we're going to begin our focus. So it could be the residential home. It could also be a child care facility or a school. So we will do supplemental inspections at other areas if we identify that that could be another source of the child's lead poisoning. If lead hazards are found at the property during the risk assessment, we will issue lead hazard control orders to the property owner. Those lead hazard control orders must be abated by a licensed lead abatement contractor. No other excuse around that one. And those orders actually stay with the property. If the family were even to move out, property owner is still responsible for those orders. We will provide a full risk assessment report that identifies what those hazards are. Also, when we do a risk assessment, we are testing every painted surface, whether it's deteriorated or not, friction and impact surface. We test all surfaces. So we will tell you surfaces that may not be a hazard but do contain lead-based paint. So you will receive that all in the report. And as Steve mentioned too, all that is available online. You can search by address under EasyTrack and find out what properties do have orders on them. So lead hazard control orders. In the city, you have 30 days to respond to a lead hazard control order. I understand that is not a lot of time to completely abate a property that has lead hazard control orders. But we want to make sure that we get a response back, that the state allows 90 days. It is something that we want to make sure that we're addressing it quickly, because those extra 2 months could raise a child's blood level a lot higher, and that child could get sick and a lot faster. So we give 30 days to respond. Now, response to our lead hazard control order, you may request an extension. You actually submit in writing to the risk assessor, perform the inspection that you would like an extension and the reasons why. You're trying to hire a licensed lead abatement contractor, trying to secure funds, what you need, and you may request up to 3 90-day extensions. So as long as we know you're getting back with us and we know you're trying to address this issue, we are willing to work with you. We don't want to do fines. We don't want to do housing court. We want compliance. We want this to be a lead safe house for children. So, we're not in the business to try to be mean. We don't want to be very forceful. You could also just hire a licensed lead abatement contractor, have it complete the work and pass a clearance inspection, and we're off your back. Orders are lifted. Additionally, we do have our closed lead hazard control program that you can apply for. The risk assessors they will grant an extension if you apply and complete the application. They will only grant the extension if it's a completed application. Numerous people try to just apply and, I applied, but we haven't gotten a complete one, so you're not even in the program. You can sell the property. You do want to make sure you disclose the disclosure rule, and we'll talk about that in the next slide. And then there's non-compliance. People who just ignore us, don't want to comply. There are repercussions to that. We have loss of Section 8 funding. We will actually vacate the property if the children are still there, so you're going to notice a vacate or plaque of the property with a nice pretty placard that says this house contains lead. And we'll eventually take you to housing court. Here within the City of Cincinnati, we do have prosecutors that we do take cases to help report that are in non-compliance with us.